One other moderator comment that I want people to be thinking about, and we're going to migrate into the poll, and that's specifically about this concept of why do we document? You know, is it to share information with other people? Is it for, you know, the purposes of billing and all those things? You know, what came up on a couple of different things in the chat was the idea of care plans. And I know when I was at the federal government, and now Andy's, you know, working through this idea of a longitudinal plan of care. So in other words, instead of just using documentation to talk about the past and what the past has happened, that we might even consider using it as a tool for outlining what ought to be happening and the trajectory for which this patient should be going and how we're going to achieve that trajectory, the specific plan of care. So just a thought to, you know, we're not going to have time to discuss right now unless we go through the poll really quick. So a couple of interesting things, certainly feel free to comment in the chat. Craig, if you want to go ahead and bring up the first polling item, what we thought we'd do to try to prioritize things now is to get a feel from the group in terms of what you think are the largest problems that we have. So first question, which of these documentation domains causes the most amount of burden for what we document? Is it reimbursement payment? Is it regulatory? Is it quality? Is it poor usability? Is it lack of interoperability? Or is it self-imposed? In other words, we've done this to ourselves. If everybody could select one, that would be great.
I am dying to see these results.
I know, me too. Thanks, Kevin. And we're bringing Kevin back for the discussion as well. Thanks, Kevin. Ah, interesting. Interesting. I welcome your comments too, Kevin, but of course, it looks like the one that won, but only by a very narrow margin, is the biggest burden is regulatory and accreditation requirements, followed closely by reimbursement and also closely by, you know, self-imposed. We've sort of done this to ourselves by never deleting anything and, you know, keeping on adding things. Any other comments, Kevin, from your point of view?
This is great to see. I mean, I think, you know, Mary and Andy in particular, I think we're hinting at some of this, and we brought up all of these issues, and I think the chat gave us some great opportunities to think through this more. So this is great.
And just again, a little bit of context here as to what we're going to do with this from the steering committee standpoint. As we migrate through the sessions that Sarah outlined at the beginning, you know, we're going to be going from a better articulation of the problem right on through solutioning. And so we're hoping that focusing on the higher priority areas are actually going to be helping us with solutioning. And in other words, talking about the plan for these short-term goals that we talked about, the 3-month, 6-month, and then the longer term ones. So this has been very helpful. Could you please bring up the second poll, Craig? And this that now asks us where we should be directing our attention to improve what we document. So the previous one was, what do you think is the biggest problem? And now, do you think we should focus our attention on that category, or is there lower hanging fruit that we should be focusing on? And so again, reimbursement payment, regulatory, quality, poor usability, lack of interoperability, or self-imposed. Okay, interestingly, shifted a little bit, but not much, right? So we've got regulatory and accreditation winning again by actually even a greater percent. And this time it's followed by the self-imposed and then the reimbursement. Realizing probably that this self-imposed idea, we can probably, it's lower hanging fruit, right? Than not worrying, but trying to do something about reimbursement or payment. So that's actually quite helpful. Kevin, any other comments from your standpoint?
Well, yeah, I think, you know, the self-imposed criteria one is fascinating, isn't it? And it's almost like some of the homework we could do in between meetings is to go into our own organization and find out how many things that people believe they're documenting have a clear reason for why they're doing it. Because you know, I think it's getting back to get rid of stupid stuff. And it would be nice for us to all come in recognizing the extent to which this is really an experience in their own organization.
Yeah, that's an excellent point. In fact, Sharon, I think, was the one who brought this up at Mayo, that they had done this back, unless it was Sherry, but either way, they had done it back in spring. And by the time it went through everybody's checks and balances, they ended up eliminating absolutely nothing. And so what they ended up doing is letting every nurse just decide herself or himself what they were going to document. So I think that's kind of an interesting one. All right, we've got a third polling question. And when Craig gets that one up, who do we need to work closest with to eliminate the majority of the burden associated with what we documented? And again, you get to pick one: CMS, ONC, NCQA, EHR vendors, HL7, American Medical Association, American Nurses Association, or our own healthcare organization. Please pick one, and as Kevin would say, quickly. Okay, and so overwhelmingly, CMS wins by a huge majority, and then our own organizations follows with a second. So this clearly goes back to Mary Green's presentation and this division that she's actually the director of, and some of the things that they're chipping away at. And it also tells us that as a group, that's who we need to work really closely with. Probably not a surprise. I will comment, Kevin, that I'm a little bit surprised by EHR vendors being as low as it is, because when we think about some of the usability and other kinds of issues, that's been a focal point in the past. But interestingly, that didn't rank real high on our previous two polls.
It doesn't surprise me. Mary, are you still here?
I am. I feel like a winner.
Are we correct? I mean, from your perspective, are we correct in saying that as goes CMS, so goes some of this problem?
Well, I think that one thing that is correct is that when CMS puts out rules, other plans, other payers will often do a similar thing. So we do have that kind of cascading effect. And I think the key for us is going to be, for all of us collectively, is, we can use the words "let's decrease documentation requirements," but the key to being able to do that is systematically how to tackle it, because it's easy for us to find line items to fix. Say, oh, you don't have to do that line item, you don't have to do this line item. But we're probably talking about taking a more holistic view here. And is there a different, I don't want to speculate what the solution is, because I know we're going to talk later, but we're going to have to figure out how to break down that problem. And I know that that's some of the conversations that we're going to have. I am surprised, though, that there wasn't more interest in interoperability, because a big problem with the documentation is, yes, the requirements, but it's also everybody documenting the same thing over and over and over and over again, and documenting it for different purposes. The same information for different purposes, different forms, whatever it is. So I think the interoperability piece of that's going to be really important. So once you document something, that's useful wherever it needs to be. So it'll be interesting as the conversations go to learn a little bit more about how to bring those things together.
Thank you, Mary. If I can ask one more question, Judy. The Joint Commission is getting a lot of attention here. And well, you say of course, but I'm a teeny bit surprised. So I'm just curious, do people believe, if we were to ask people about Joint Commission versus CMS, would most people say it's one or the other? Anybody want to comment on that? Brent, you've never not commented.
They function in fundamentally different realms, Kevin. If I had Mark Chasson here talking about what CMS is attempting, and I'm sorry, TJC is attempting to accomplish, he'd look at it as infrastructure that's required to be able to perform at any level. And he would distinguish it between that infrastructure level and actual quality of care. Believe it or not, it's just necessary elements that must be in place in order to function as a care delivery organization, is how he would look at it. That's why he formed that, I can't remember, it's the Center for Innovation that he formed, was to carry things to that next step forward. So while they do require some level of documentation.
By the way, I agree with you, just to be for the record. Yeah, I feel this. I would have felt the same. But I think this audience is an august group, and I think if that's going on, we need to better understand and help inform people about where the actual best levers are for us to move this forward. You know, Don Detmer was one of the people who coined the idea. Dr. Detmer was one of the people who came up with the idea of this conference. The idea being that we should be at 1/4 the total amount of documentation we currently have now in 5 years.
Yes,
Don, are you on? How do you feel about what the poll showed and what we
well, I
said so
wanted
far?
I wanted more than one choice, sadly, but that's the way I live. So first of all, I guess it's been a fabulous day, and I think you guys, everybody involved, has kicked us off splendidly. So, you know, that's I need time to integrate what I've heard today, but I think we're doing what I wanted to see us do. So thank you, Kevin, for giving me a chance to weigh in.
Of course. Judy, back to you.
Yeah, if you could, Kevin, can you put up our slide deck again? Because our last slide has the sort of wrap-ups information.
Sure will.
And while you're doing that, Sarah, anything else you want to comment on, or Trent, in terms of the overall?
Just that I think we're thrilled, you know, with the participation, the chat log. It's an incredible discussion. We will be saving the chat log. We are recording this session, and so we will make that recording available. So thank you, everyone. We hope to continue these chats, and to have that information moving forward will be really valuable.
Thank
Trent,
you.
any comments?
I have been sitting here trying to parse all of this chat and all of these presentations and putting it on Twitter. A lot of you have also been tweeting. Thank you for that. Please keep using that hashtag. We'll try to make things a little bit even more tweet friendly next week by catching user handles. But mostly thank you all for all your energy, both in presentations and in the chat. Keep thinking about this. We will eventually be giving you homework to do between the weeks. But right now, really just take the time to digest, think, and be ready to kick it off.
Thanks, Trent. So as you might recall from Sarah's presentation at the beginning, you know, this is a journey of 6 weeks. Week 1 and 2 are both really setting the stage for the problem. And so today we focused on what we document, and next week we're going to focus on how we document. And so panel 1, it's going to follow a very similar format to this one with the 10-minute segments. Panel 1 is going to talk about data entry challenges. Panel 2 is going to be talking about alternative data entry. And then the format will be actually similar to session 1, as I mentioned. We'll have one panel with some Q&A, second panel with Q&A, and then some polling. Because we have a minute or 2 extra, believe it or not, everybody kept so good to time. Thank you so much. Patty Sengstack and Chris Lehman are going to coordinate session 2. And I'm feeling like we've got time to open it up to a comment or 2 from them in terms of a sneak peek at what's going to be happening. If either one or both of you would like to make a comment.
Oh, I love that you just put us on the spot here, Judy. No. No, that's fine. We're actually excited about it. We've been talking about it a lot with our panelists, who are wonderful folks that are going to be sharing a lot of great information just like today. So the focus will be we talked today a lot about how it got in. I mean, what goes into it, but we've got some great information coming up next week on how it gets in, sort of call it the good, bad, and the ugly of how it gets in, that we're looking forward to our panelists presenting next week. Chris, are you on the line?
Oh,
I am, Patty, and I couldn't add anything more other than we will be talking about you know, the pains that are associated with documenting and getting data in, and the challenges that we encounter, and you know, also the pitfalls and potential complications from things like copy and paste. So we're looking forward to next week.
Great, thanks the two of you. And last but not least, we're hoping you can stick with us all 6 sessions because we're really going to need your expertise in session 5 and 6, which is when we're going to have the breakout sessions and actually, doing the planning itself. So if you can't participate in them all, hopefully you can at least listen to the tape after the fact and get caught up so that when we come to session 5 and session 6, that you can actively participate and help us with the planning. As with anything of this sort, some of the work is going to be happening after the 6 sessions, and we'll be looking to form some work groups and looking for participation at that point as well. Kevin, any other closing thoughts?
Not a one. I want to once, well, of course there is one. I say not a one except for the one I'm going to say. I want to once again thank all of our panelists today who really were outstanding. For those of you who don't appreciate this, meetings like this take a lot of coordination, and especially to do multiple sessions over multiple dates, which meant the dates were locked in. And we were able to get a number of really, really perfectly timed or positioned people from around the country to participate on the date we actually had to have the meeting. So I want to thank everybody for accommodating that, and obviously thank all of you for being so engaged as the chat is more than demonstrated. So wonderful, thank you, looking forward to next Friday.
All right. With that, we'll close out the session a couple of minutes early, and we thank you all for your active participation and look forward to chatting next week. Bye-bye.
Bye-bye.